Good morning, everyone. I really appreciate the question on HPV, the comments, the likes. May God continue to bless you. So, our today topics we are going to talk about PID, which the meaning is pelvic inflammatory disease. So, we are going to talk about PID. It's also an infection. It's not an illness. It's not a disease, but it's what? It is infection. Pelvic inflammatory disease is an infection that occur in your uterus, fallopian tube or ovaries. The most common symptoms are pain lower your abdomen or pelvic. As in, when we say PID, PID is an infection that occur in your uterus, fallopian tube or your ovaries. And the most common symptoms are pain over lower your abdomen here, under your stomach. You feel the pain, as in sharp pain. Irregular vaginal discharge is also part of the symptoms. Painful sex, when you're having sex with your partner and you're having pain inside your purpose inside, it's also symptoms of PID. When certain bacteria spread from your vagina to your reproductive organs, it's called PID. So how do we get PID? Most people get PID through unprotected sex, and sex lead to bacteria. It makes it enter your reproductive system, where they can affect your organs. So you that just ask sex anyhow, please, let's try to check ourselves for infection, and let's try to treat ourselves for infection frequently, because PID is a very high infection in the body. So symptoms of PID: we have pain or tenderness in your stomach or lower abdomen, that means belly. The most symptoms is what? Abdominal vaginal discharge, usually yellow or green with unusual odor. When you start discharging like yellow, green and unusual odor, my sister, you have PID. The other one is chills to fever. When you chills to fever, as you feel feverish all the time. And then nausea and vomiting is also part of PID. And we have pain during sex. We have burning when you pee. My sister, that one has increased though. When you can detect that easily, when you pee, but your vagina is burning. When a man that has gonorrhea had sex with you, because man can keep infection for 15-20 years, but you that not have small infection, when a gonorrhea man had sex with you, it will bring out all the infection in your body. And we have irregular period, or having spotting or cramps throughout the month. Irregular period can cause you unable to get pregnant, and it can lead to early stage menopause. When you are having PID, once you are having irregular period, my sister, go and check yourself. You that you are now giving birth, or you are even married, that you know you still want to give birth, please, let's try and check ourselves, and let's take notice of our body. The causes of PID: we have bacteria. When bacteria enter your reproductive tract, causes pelvic inflammatory disease. These bacteria are passed from your vagina through your cervix and end up into your uterus, fallopian tube and ovaries. Normally, when bacteria enter your vagina or your cervix, keeps them from spreading deeper to other reproductive organs. When bacteria enter your body, through vagina, fallopian tube or cervix, it keep it deeper. That is before it generate out in your body. Let's say if you are lucky that your body don't keep something, let's say like 5 years, some people 6 months sef when you get to have infection, but it will come from discharge, itching through your vagina, you burning of pee. So once you notice all these things and you see your health assistant, so it's going to explain much about that for you. And then we have gonorrhea. Gonorrhea can cause PID, like I said. When a man that has gonorrhea has sex with you, my sister, PID. Now you are now PID patient. Me, I like money. When it's come to PID, you see me giving you bill of 80-70,000. The PID, I will not treat PID for you this month and come back next month again. I will never do that. And then STI, sexual transmitted infection, causes PID. At least commonly, PID happen when normal bacteria get into your reproductive organ. This can happen after mothers, when bacteria enter your body to get into reproductive system. This can happen after childbirth, miscarriage, pelvic surgery, getting an intrauterine device, that is IUD. This is the highest risk in few weeks after you provide at IUD. There are some risk, my sister. And PID is contagious. Yes, it's contagious. PID is contagious. Yes, PID spread most often during direct sexual contact. PID spread when you have direct contact of sex. What is the complication of PID? Chronic pelvic pain. You know when they say chronic pelvic pain, you have pain here. Here, sometimes it will go, it end up at your back like pile here. So once you have pile, it is infection. No, you have pile. You go inside, go dedicate it, it will go. Later, it will come back to you. It's called chronic pelvic pain. And we have ectopic pregnancy. It causes ectopic pregnancy because ectopic pregnancy is what is in the wrong position. Once you have ectopic pregnancy, my sister, they will operate you to bring it out because the pregnancy is not in the womb, is a negative side. So PID also causes infertility, unable to get pregnant, because PID, once it gets to irregular period, it leads to early stage menopause, and when you don't do period, you cannot get pregnant. PID, listen, PID also causes infertility, and then it's also called tubal ovarian disease. This is a pocket of infection. Yes, TOA. It's a pocket where infection keep themselves in your pelvis that can make you extremely sick. Tubal ovarian abscess is a pocket of infection in your pelvic that can make you extremely sick. And a diagnosis for it, we have a pelvic exam, a vaginal culture, we have urine test, we have ultrasound, we have testing for UTI, and we have blood test to confirm for it. If you need a treatment, please contact me through my TikTok account, message me, comment. Thank you as you watch and listen. May God continue to bless you. Our health is wealth, and your health is my priority. Thank you.